Hi, we're going to walk through the procedure for setting up an arterial line setup. I'm going to wash my hands first or use the alcohol. These are the supplies you're going to need for setting up your arterial line on the monitor. And an example would be if a cardiogenic shock patient or anybody from the critical care unit comes to our area and doesn't have a bed ready, then you'll have to keep that patient here in our department, maybe up to a couple hours. So this is how you might have to set up an A-line if you ever needed to in an emergency or if a patient stays here for some reason. All right, I'm going to get some gloves, but we're going to start with our normal saline bag. Open the bag, get my trash. This is the tubing that you're going to need, and it's located in clean holding. Open up the tubing. This is what it looks like. It has a transducer, so you can monitor the arterial line. Sometimes even the ICU upstairs has equipment to have like blood sampling port, but we don't have that stuff here. So what we're going to do is keep that sterile. We're going to burp the bag here. I want to get out all of the air from this normal saline bag. I'm going to push some air into my chamber. I'm going to take my spike out, and I'm going to burp the bag full of air. And now there is no more air in that saline bag. It's nice to have these labels already set. I'm going to put a label on it with the time, date, and my initials. Take my pressure bag. Make sure you get the appropriate size. This is for a 500 milliliters. And they have ones for 1 liter. I'm going to hook that there. Put it here. Now what I'm going to do, I'm going to close my chamber. I'm going to pump up my bag to 300 millimeters of mercury up to the green line there. Okay. And I'm going to clamp this off so no air escapes from this bag. I'm going to open this back up. And now what I'm going to do is tighten this connection here. Tighten all these connections because they get loose when it's getting sterilized. I'm going to push the stopcock the other way so the fluid can go down this way. And I'm going to take out the air. You can do this over a sink or what have you, but I'm going to take the air out of the tubing here and make sure there's absolutely no air. And so what I've done is gotten the dead enders. These are the white end dead enders. I'm going to put one on each little hole. These ones, these that come on the tubing itself, these have little holes in them, so you don't want those left onto your tubing. So we're going to just keep on going, taking out the air. So I'm pulling my pigtail here, the blue part, to take the air out. And every time I do, I'm just going to put another dead ender on the opening. Okay. Whoop. Let's get a different one. All right. And then the last one. And that is how you flush the tubing. This part, what'll happen is that this will connect into the side of this monitor here, to this side of this monitor here. There you go. That's how it connects to the monitor. And then this end will connect to here. And this one goes to the patient's arterial line, wherever it is. And once you're connected, you would go through a zeroing process on the monitor, which would sorry, instead of PAP, you would choose art line, maybe, as long as it's red. Yeah. To zero it, this would have to be level with your phlebostatic access. You would close it off to the patient and open it up to air, and then hit the 0 on your monitor. Oh, where is it? But you can zero it here. 0 art line. Oh, there's your 0. So once you've zeroed it on your monitor, it's 0 now. And I'm going to hit the 0 button, and the 0 will appear. The next step is to close the opening here and open it up to pressure. And it should always stay level with your patient's phlebostatic access, so level with the heart, basically. And it'll give you a pressure in that region. And that is how you do an A-line setup. So that's it. Thank you.